Army prepares to administer 1.6 million flu shots. The Army estimates it will use approximately 1.6 million doses of the injectable influenza vaccine, more than half of the total number of doses ordered by the DoD annually, to keep both active duty and reserve soldiers, civilian staff and family members healthy during the upcoming flu season. For the 2016 to 2017 flu season, only injectable flu shots will be provided to soldiers, federal civilians and beneficiaries. No live attenuated influenza vaccine, known as flu mist, will be offered based on effectiveness recommendations by the Centers for Disease Control and Prevention Advisory Committee on Immunization Practices. The Army's flu shot supplies will start arriving at military medical treatment facilities as early as September. While some people only think about flu vaccines during the fall and winter months, Army Flu Manager Miguel Rivera Jr. said preparing is a year-long mission. Each year, Rivera, who is assigned to the U.S. Army Medical Materiel Agency, which is a subordinate organization of the U.S. Army Medical Research and Materiel Command, reaches out across the Army to work with other preventive medicine experts and logisticians to estimate the number of vaccines needed for the upcoming season. This calculation starts in February to allow the Defense Logistics Agency enough time to tally the total number of doses needed across the Department of Defense and order supplies. The goal is to immunize with flu shots at least 90% of service members and healthcare professionals by December 15. If people do not get their flu shots by December, we still encourage them to get immunized, said Lieutenant Colonel Charlene L. Warren Davis, USAMA's Pharmacy Consultant and Distribution Operations Center Director. The flu vaccine is usually viable until June 30. National Immunization Awareness Month, observed in August and sponsored by the National Public Health Information Coalition, is a month-long observance intended to encourage people of all ages to make sure they are up to date on the vaccines recommended for them. Most people over the age of 6 months will benefit from an influenza vaccination. In the most cases, according to the CDC, the risks associated with getting vaccinated are significantly lower than the benefits. By getting vaccinated, each person can keep their loved ones safe. Getting vaccinated protects others who are more vulnerable to serious flu illness, such as older adults, people with chronic health conditions and young children, especially infants younger than 6 months old who are too young to get vaccinated. Also, vaccination has shown to make the flu milder, which may reduce the risk of more serious flu outcomes such as hospitalizations.